program, we'll be talking about Introduction to Community Health Nursing. In the studio, we have on my extreme right, Mrs. Rita Sarkar. She is one of the senior faculty at School of Health Sciences, Indira Gandhi National Open University. On my immediate right, I have Mrs. Sunita Patni, who is a senior faculty from Rajkumari Amrit Kaur College of Nursing, University of Delhi. Welcome to the studio and to the topic which we are going to discuss today. Now, you know, as nursing personnel, community health nursing is one of the very important field for any nurse who goes through the training. In this particular course, you will be expected to go to the community, work with the community people, make the community diagnosis, help the clients in the community to prevent themselves from the diseases, to take help in case the help is required, and those people who are coming back from the tertiary care, that is from the hospitals, to follow them up and help them to get rehabilitated so that they become socially productive. So, as a community health nurse, you have got a very major role to play in rehabilitating the people who are going through stressful situation of sickness and prevent the morbidity and mortality rate in the country and in the community in which you work. I request the experts to discuss and explain to you what is community health. What do actually students would learn and what does it mean, the word community health? Mrs. Patni, please.
Yes, community health is an important aspect for nursing personnel. So, community health is, we can say, is different from what is hospital care. So, it is important for us to know what is community health. Now, before that, I would like to say what is a community, because sometimes we find it difficult to identify the community. So, community is a group of people living together, sharing the same resources and same values and same type of interest they have. Now, this is a defined community living in one defined area. We can always name one community. Any area in a Delhi or other state, whosoever we name, like Lajpat Nagar, this may be one of the community. Now, we must not differentiate, we can differentiate this from people who are living together temporarily, like in one hostel where group of people are living together sharing the same resources is not a community. A community should be, the people should be permanent resident of that place. So, that is a community. And when we talk about community health, that means this is our concern. We as health personnel have to take care of the health of the community. Sometimes it is easy to say health care of one individual. We do assessment of health care of one person, but it is difficult to identify the health problems and health needs of a large number of people. In that case, we need to know about the community health. Community health is an art of science of preventing disease, prolonging life and promoting the health of the people. Now, how it is art and science? Because it is based on certain skills. It is based on certain our previous knowledge. And how it is science? Because it is based on certain scientific principles. We have certain principles which we will follow later, that what are those principles we need to keep in mind when we are giving health care to the people. Now, when we say about community health, that means this is related to our nursing aspect as well as community health. Now, this is not only the role of one nurse to take care of the whole community health. There is a number of it is a teamwork and the whole team work for community health. So, this we can briefly say about community health.
How would we define the term community health nursing?
Now, when we talk about community health nursing, it is the synthesis of community health and nursing. We all know what is nursing. Nursing is a systematic way of giving comprehensive care to an individual or a group of people. So, in community, it is the nursing personnel who give the health care aspect to a group of people. When we talk about community health nursing, it is a synthesis of nursing as well as community health. When we talk about community health, that is, we talk about environmental sanitation, nutrition, prevention of rodents, prevention of mosquito breeding. Now, these are certain aspects which are not directly related to nursing, but they are related to community health. So, how can we intervene? What nurses has to play the role in providing community health to the community health care to a group of people in a particular community. So, when we have to give care, we have to identify what are the health needs and the problems and provide nursing care to a group of people.
Now, what is this community health identification? Because you gave us that community health is health of the community. You talked about nursing role, our community health nursing, what it is. You have also used the word repeatedly, community health identification. Now, what is this community health identification, Mrs. Bhatni?
When we talk about this community health identification, that means before we give the care, we have to identify the health needs, the problems, and we need to know about the community to whom we are going to give care. So, to explore the community, to identify the community, to know the community is community health identification. That means we need to identify the particular community, its location, its climate, like we can say about geographical aspect. Then we need to know about demographic aspect, that means what are the age wise distribution, what is sex wise distribution, what is the health status of that particular community, because we have to give care, plan care according to the health status. Sometimes we plan the care and we already go and see that the community is maintaining its good health. So, that means our all planning is gone waste, because those services are not required for a particular community. So, before going to even planning, we need to identify what are the resources, who are the leaders, which are their cultures, what are their practices, what are their health beliefs. All this we need to know about a particular community. So, we need to identify before we go for planning. So, this is defined as a systematic process. When we talk a systematic process, means it has certain steps which are followed. There are a series of steps of knowing and exploring a defined community for assessing the health status and determining the possible factors affecting the health of the people. So, we have to find out which are those factors, so that what we can do for a community, we need to plan, organize and implement the care.
So, I think this is very important for any nurse to understand that what is community health, what is community health nursing, and what is community health identification. And I am sure there are certain information which needs to be obtained to make the community health identification. What are some of the information, Mrs. Sarkar, we want to gather where the students should be able to make community health identification?
Before going to identification of that community, as a community health nurse, you must know the community map. So, you should be aware about the community map, and you should be aware of the resources in that community. So, what are the post office is there, how many primary health center, how many sub center, and how many community health center, referral hospital and district hospital, you should know where is the post office. You first identify and prepare a map of that community, areas of that community, how many families they are living. When you know the map, then you go step by step. After that, knowing the map, geographical characteristic, then you come to know about the demographic data. How you will get the data? By holding formal and informal meeting with the community people. So, just go to the community and formally you can collect the data, and informally also you can collect the data. From that you will come to know about their family size, about their nutritional status, about their status in the community. So, by holding the meeting, then after that observation visit. Observation visit is important for a community health nurse when you go to the family. So, by observing only you will come to know, if you see the family member, how many family member, old member is there, an infant, then a toddler, then antenatal, postnatal, you will come to know by observation. You will come to know risk, high risk group, who all are the high risk, like toddler, infant, antenatal, postnatal. So, you will come to know by observation, you will come to know. Suppose if you observe one mother is antenatal mother, if you see she is pale, then you will suddenly then you will diagnose, oh, she is pale, then she must be having anemia. By the observation you will know the family, you will come to know the what type of disease is there in that family or in that community. Then informal conversation with people. So, informal conversation with people, with the leaders, those who are leaders, informal leader and formal leader. So, you will from them you will come to know what type of disease and what type of health services are there. From them only you will come to know. Going through records, when you are posted in the primary health center or community health center, if you see the record, by the record only you will come to know the their vital statistics. So, you will come to know what type of disease. Suppose if you see the toddler card, you will come to know what type of immunization he has taken and what are the dues. So, by antenatal mother, you will see antenatal mother is taking any medicine, then even vaccination also, like antenatal mother has taken tetanus toxoid or not. So, by that, you will come to know from the record only, you will come to know their health status, even health events. Then you will come to know sample survey. From the sample survey, you will come to know the birth rate, growth rate, death rate, then infant mortality and maternal mortality. From the sample survey, you will come to know. By discussion with health and health allied person, when you go to the community, if you discuss with other health members, and then you will come to know the health status of that community. So, in that way you will get information about the community, and after that when you will know the community, then only what you do. The next step is community diagnosis. When you identify the community, then you will diagnose the community. In community diagnosis, this will highlight mainly health problems and health needs of the community, which you should be able to assess from the information. From that information, you know what family size and what type of disease is there, their personal environmental status also you will come to know. This then you diagnose that family. But in India especially, if you diagnose the family, what type of diagnosis mainly you see? By your diagnosis, community diagnosis, you may see that mainly large population. In Indian situation, if you go as a community health nurse, you most probably in a community health center covers 1 lakh of population. So, if you go and see, it is not even 1 lakh, more than 1 lakh. So, that large population is there. Then literacy rate is especially 50% literate in rural areas. Then poverty. After that, high morbidity and mortality. High morbidity and mortality still health for all we have not achieved, but still government of India is taking so many measures, but still high morbidity and mortality is there. Like I will give one example, maternal mortality in India. In maternal mortality in India, 400 per 1 lakh live births. Suppose if we compare in developed country, there are 6 to 10 per 1 lakh live births. See, think 400 and there is 6 to 10 in developed countries. So, it is very high in India maternal mortality. Like that, then prevalence of risk factor. So, you will see so many risk, communicable disease and non-communicable disease are prevalent, especially in the community. Then poor personal hygiene. Due to poor personal hygiene, community is having so many diseases. Like due to poor personal hygiene, they may get affected by disease, like if they take so many nutrition also, they may have nutritional deficiency, they may have diarrhea, they may have gastroenteritis due to poor personal hygiene. So, then traditional culture and practices and references to antenatal, natal and postnatal care. Like in postnatal care, I will just give one example. Traditional practices is there, not to give breast milk for 2 to 3 days, because they say that fast milk is not good for health in the rural areas, but it is not that. Fast milk, this colostrum is very good for the health, and they should be given, it should be given to the child. So, some traditional practices is there, they just express the milk for 2 days, then they give milk to the infant. The lack of health knowledge, due to lack of health knowledge, they are having so many diseases. So, by this identification, they will come to know about the community and they will diagnose. This is the main problem in India.
Information can be obtained by various methods. It can be formal, informal, it can be survey, it can be just talking under a tree with the panchayat head. So, the information about the community is obtained, and after the information is obtained, the community diagnosis is made. And once you have made the community diagnosis, that means you have learnt about the community through mapping and have found out that in that particular community so many families are suffering from this kind of problem, or this particular family is suffering from this kind of problem. There is a small child, or there is infant, there is adult who is going through fever, and there is an old man. So the whole family structure the nurse comes to know and finds out that this is a particular family which requires the care, immediate care or late care. After making that community diagnosis, once actually you as a nurse go and work in community health, probably you face many other problems. And as a community health nurse, you have to see that keeping those problems in mind, that instead of having 20 people, you may get 50 people. But how to cope up with those problems? That it is very easy to talk to a literate group up to some extent, than to a group who is illiterate for a certain reason. For a certain thing, you may be able to convince to the illiterate people better than the literate people. So those problems as a community health nurse you have to foresee, and you should be able to handle. I am sure this gives you an insight of knowing that working in the community is just not going into the community and saying, you know, that all of you come for the immunization and all. No, the people are not going to listen to that. You have to develop that kind of a rapport, make the community diagnosis, see how many children are there who require immunization, and you say that this particular child in the family, almost you have 20 to 30 children in your village. So we will be coming here and having an immunization camp on such and such day. I will come one day before also. If any infant is having fever, we will not give any immunization to that particular child, and we will try to see that the fever is reduced. So the families feel that here is a nurse, is a community health nurse who actually believes, in spite of the problem, in spite of the large population, is able to attend to the care of the community by making community diagnosis. Now I think it is very important that some process has to be followed, and what is that community health nursing process which needs to be followed when a nurse works in the community? Mrs. Patni, please.
And we must have some process, some system of working. We just can't straightway go to the community and say that I would like to do this according to the choice of a community health nurse. No, it has to be based on some basis, and it has to be based on some principle, and some steps has to be followed. Now when we talk about process, you all must have seen about nursing process, or followed the nursing process in the hospital setting. I would also like to say that community health nursing process, even the steps may be same, but the way of working is different because two settings are different. And in community health nursing process, I would like to emphasize on one thing, that in nursing process or hospital care, we are really satisfied because we see the patients progressing, which we do not find in community health nursing process, because it takes very long time to organize our activities, to implement the care and evaluate. After evaluation, we may not find much changes in the people, but still we can emphasize more and more by reinforcing. We can say that definitely community will make the change. Now this is because not only one individual, it is a group of people. It may be 1,000, it may be lakhs. So we have to motivate them towards changing their attitudes and behavior, what they have been practicing as unhealthy and which we want to them to change as healthy practices. So to bring that change, we really need to follow this process, and it is, if you see your figure, it may say that evaluation is the end, but evaluation is not the end, that may be the beginning. So we can say process is a continuous systematic series of steps of providing health care to a group of people and solving their health problems. As already emphasized on identifying the health status, the health problems and the health needs of the people. So first and foremost, we must know what is a community, the health problems and health needs. In this community health, I would like again to emphasize that in community health, people are not coming to us. It is we are going to people, and they may not feel the need they are required. They will say, we are healthy, we don't require you, why are you coming? So these may be some of the questions they may ask. Whereas in the hospital, patient comes to us and he needs us. So in that case, he needs and he will say whatever you tell them. But in community health, we have to maintain a working relationship. Now this maintaining working relationship is the first and foremost step of giving care, because there we need to gain trust and they need to have confidence in us, and that we can always ensure them that whatever you talk to us, we will keep it confidential, and maintaining a good relationship, and this relationship must be professional. If we are going to be going to a family, it is not that we are becoming a member of a family or we are having a casual talk. No, we have to maintain our professional relationship. This professional relationship need to limit within the working relationship, that I am a professional and I have to give answers only to the required. She may ask many things, but we have to see that what I am going to answer to her, or how I am going to sit, how I am going to stand, how I am going to act, how I am going to work, because each and every activity will be noticed as a community health nurse. So when we are going to a family, we must make sure that we provide good services to them, so that they are having trust in us, they are having confidence. This is because when we collect the information, they will give the factual information. Otherwise, if they have no trust in us, and if we have the wrong information, that may lead us to wrong actions. We may she may say something else, and our actions further process may not be accurate. So maintaining relationship, then assessing the health situations. Now when we go to the family, we have to examine each and every family member. It may be a mother, a father, infant, toddler, antenatal mother, and their health status. So how is she keeping? What are their health needs? What are health problems? What are their factors which are influencing the health? That also observe about their lifestyle, environmental sanitation, the resources available. This all we have to observe. Then it may be done by questionnaires. Usually you must have seen a performer prepared by a community health nurse. She will have all those information necessary to be collected, and by observation. She must be a good observer, because she has to observe certain things which mother may not tell, or she may hide, but we can observe. Maybe mother is having not a good relationship with the husband, but she does not disclose, but by observing we can say that this is what, there is some psychosocial problem in the family. Then by through the records, usually it is said that before we go to the family, there is a family record. We need to go through those records, because half of the information is collected from within the family, and then if we know the family before we go to them, again it is of good, they will have a good faith in us, because we know the family already, and we call them by name, that Mr. so and so, Mrs. so and so. They will be more close to us when we work with the family. So after we identify the situation, then we need to establish the goals. Goals, as we know, it is very important. Goals are which are the end which help us to give the direction towards at the end to achieve what has been achieved and what not has been achieved. So setting goals is very important, because there may be many problems of one particular community. We have to limit our achievements to be done. So we have to set which are those goals which we need to achieve and immediately, and which we can achieve little later. So we can say that there can be two types of goal, short term and the long term goals. Short term will help us to achieve at the initial level, and long term we can take some time to achieve them, because we have to set the goals according to priority. We have to see the needs, that which are most important needs, without which family cannot work or a community cannot work. Like for example, if there is poor environmental sanitation or unsafe drinking water, the immediate will be giving safe drinking water to a community, because this will help to prevent various waterborne diseases which can be life threatening, like diarrhea or dehydration, and then cholera. So this is the most immediate which we may need to set in the short term goal. And like Health for All, they have certain goals, they are long term goals. To achieve those long term goals, we need to have the short term goals, like infant mortality rate. That is the long term goal to be achieved 60 per thousand by 2000 it was, now it is by 2020. So to achieve that goal, that means we need to improve the antenatal care, postnatal care, and training the DIs and all that. So that is the short term goals. So after these goals, we need to plan and implement the program of action. Now planning are the guidelines for action. When we have a set goals, we need to have certain guidelines that how we are going to plan for action. What all are we going to go do with the families or with the community? Now in that case, we need to, there are certain alternatives of giving care. So we need to plan what has to be done. Now these alternatives of selecting actions, and that will lead us for implementation. For example, there is a sick person at home and there is need for giving care to that person. Now decision has to be taken that who will give care. Is it the community health nurse, or is it a member of a family, or we need to engage somebody else who can give care to that sick person. Now out of these, which is the most possible and most appropriate has to be selected. Then we need to have implementation. In implementation, whether we are doing supplementation, facilitative or developmental. In supplemental, we need to the community health nurse itself gives the care, direct care to the community. Or facilitative, that means she does not give the care, but she makes the arrangements or she facilitates the care. It may be she can engage anybody else and or any health personnel whom she can teach and the care can be provided. Developmental is that she will develop the health personnel. Like in a I said in a family or in a community, she is not able to give the care, but she will teach somebody that the person who can be taught and give the care in her absence. So this is during implementation phase. Then evaluation. There is no process is complete without evaluating the effectiveness of it. So we need to evaluate the program qualitative as well as quantitative. It should be, when we set the goals, it must be measurable, so that at the end in evaluation we can measure how many goals have been achieved, how many have not been achieved. Like Health for All, I said by 2000 they are able to measure that we are not able to achieve all the goals, but we have achieved some of the goals. Now quality, of course, how much quantity, the amount, and the quality, the types of services. The quality will help us to know by knowing the health status of the community. If the health status has been improved, if the people have actually listened to us, or we are able to give appropriate care, we can say that in qualitatively the health status of a community at large has been improved. And the most important aspect in giving care is health education in community health nursing. And in health education, we want to change their behaviors and attitudes, and if there is a change in behavior and attitude, at the end of giving health education, we can say that our giving care is quite effective. After evaluation, we say that this is not the end. It is again, it will help us to replan our care in case we have failed somewhere. Now evaluation, again I would say, it is not only at the end. The evaluation must be done in the beginning. It should be done in between, during and throughout the process, and then at the end. Now this evaluation can also be done by observation, by questionnaire, by opinionaires. So there are various methods of evaluation which we can adopt and evaluate the health services and find the effect of it. And if there are some points which have not been achieved, we may need to replan and see what is why we are not able to achieve, and that can be improved, and again we go back and see that this process is complete.
I think this was very interesting that you have gone through a very detailed community health nursing process, and having quoted the examples of community health nursing at various steps, that is at steps of maintaining a working relationship, also assessing the health situation by using various tools and techniques, and also establishing the goals for health, which are short-term goals and long-term goals, planning and implementing the care which is to be given to community, and very significant is evaluating the care which is planned. I think this is very important, and it is also said that it doesn't end over here, because the cycle stands again when you starts again, because when you assess the qualitative and the quantitative data, you find that the quantitative data say 100% children are immunized, but qualitatively you find that the people have not understood the importance of immunization, because there was immunization camp, because community health nurse went home to home, so the number of children, number of infants to be immunized were done, but whether that education has brought any change in the parents, father and mother, so that for the next dose they themselves ask when is the next dose, that was not happening. So that shows about qualitative data. Well, we go to a demand which Mrs. Patni has put on the work which is to be done by a nurse. That means if a nurse has to do so many works and she has to be so scientifically equipped with the knowledge, it requires a preparation. Mrs. Sarkar, would you like to tell us that what additional preparation is required by a community health nurse when so many tasks are to be performed?
Yes. Who is actually community health nurse? First, we have to see their educational background. They have to have their RN, RM, means they will clear their GNM. Then after that, they will go for certificate or for diploma in public health nursing. This is one, and those who have completed their degree course, in that degree course it is one component is their community health nursing. So either diploma and degree holder can join as a community health nursing. So for that they need preparation for GNM 3 to 3.5 years, after that diploma, then and for the BSc nursing 4 years degree. It is not that educationally they are prepared. After education, now they will be going to field. Before that, they have to prepare themselves. What type of, they have to have some competencies. What type of that? They have skills in communication and skills in observation. First, skills in communication. Community health nurse, they have to have very good skills in communication. When they are talking with the family or they are talking with one of the mother, then she should have very good listening power. Suppose she is talking with mother about the family planning, then she should know, she should understand also what is family planning and what type of family planning mother is taking, what type of measure mother is taking. So she will, by the interview, she will come to know about the mother. Then this is then she should have very good listening skill. It is not that she will just listen, then she will not do listening. By listening also she will come to know about the family planning methods, what the mother is using. Then teaching about the family planning. When she will listen, then she will say that this is the, then she can teach to the mother, she can teach to the group or a community. So she should have very good power in interviewing technique, listening technique, teaching and sharing. Until she doesn't have, she cannot share. She has to teach the community for their, and she has to motivate the people. Then only they can prevent the diseases. Like she will go to the community, she will tell that this infant will go for the immunization of DPT and polio. In pulse polio camping, they are going door to door, so that information and motivation also needed. So she should be good, she should have very good skill in communication. Then she should have observation skill. By the observation of signs and symptoms, she will come to know the disease, because community health nurse will be working where there is no doctor. When there is no doctor, by the observation she will come to know, she will diagnose the case. Suppose she visit one family and one of the person is having cold and cough and fever for long time. By observation, by signs and symptoms, she will come to know that that person is having tuberculosis. Then when she will come to know by observation, then she should know the community resources where she will refer. Tuberculosis she cannot treat. Now she will send that patient for the sputum test, for X-ray. Then for the medication also she will send to the district hospital or primary health center or community health center. So she should have very good observation skill. It is not that only the patient, when she will go to the family, she will see the environmental hygiene, personal hygiene, she should see everything, family size, what is the relationship of like mother-in-law, so what type of relationship they are having. So by the observation she will come to know, and sometimes it is not that she will diagnose the case, sometimes some patients is having also mentally illness, from observation she will diagnose. And because she will be working as a community independently, she will work in community as independently when there is no doctor. So she should have knowledges about the community resources, and she should have expertise of understanding of human behavior. When she will go to the community, she will be more human to know their behavior. If the mental patient is behaving so aggressively, she should sit with her and she will understand and she will listen the problem what they are having. So, as a community health nurse, it is not that she will be highly educated. This is the educational background. She may do masters in public health, she may do PhD also, but the basic qualification, after basic qualification, she should have some abilities for the managing that community, so that community accepts that community health nurse and community will be benefited by that community health nurse. So, this is the main preparation and competence is required for community health nurse.
I think this is very significantly pointed out by the speaker, that it is not that the person has to be so very highly qualified only, but needs to have those skills and abilities to relate with the community. If you are not able to relate with the community, you are not able to help them to find out the solution to their problem, you are not able to even look about their health status, that shows that you may be having a qualification, but you do not have the abilities to be a community health nurse. And this is what I think you have highlighted very important, because even after doing GNM, some of the nurses are very good to be community health nursing in developing a rapport. All right, scientifically you are not that well equipped. Now, after doing post basic BSc nursing, you are going through the curriculum and you know that you can make the community diagnosis, you can do the mapping of community, you can help the community better. But over and above that, it is the ability, the communication skills, developing rapport, also talking to the community, relating with the community is more significant as a community health nurse. I think this is a very important point and important qualification I think a nurse needs to have while working in the community. It is like, you know, when you work as a pediatric nurse, I mean, community health nurse has to be a blend of everybody. She has to be a good medical surgical nurse to look after if the patient is having a fever. You may correct me if I am wrong. She has to be a very good pediatric nurse to look after a little infant and the mother. She should be a very good maternal and child health nurse. If there is an antenatal mother, she should be able to attend to her. So it's a very challenging job to be.
Even she should be very good psychiatric nurse.
That's right. To understand psychological background has to be very good, you know. So what I think Mrs. Sarkar mentioned, that the preparation of community health nurse may be additional qualifications will help her to work more effectively, but definitely that ability has to be there to listen, to relate, to understand, to work in the community for the community. That's what is very important. Now, having said that, I think it is very important for us, Mrs. Patni, to discuss about some of the functions of community health nurse.
It is very important because community health nursing functions are different from functions of a hospital nurse, and these competencies are actually desired and they even take out of their training. That is how they need to have a specialized trained in community health nursing. Therefore, we have a specialized training in this, maybe 1 year diploma in community health nursing, or graduation in nursing will also give community health component, because they teach these competencies to be how to educate, how to observe, and how to have all those skills which are required for a community health nurse, which otherwise others may or may not have. So, because as Mrs. Sarkar has said that community health nurse maximum time she has to work independently in the family, and there are certain decisions which are to be made, prompt decision which may even save the life or take the life of one individual or an infant or a newborn. Suppose there is a mother who is about to deliver and there is nobody around. So, now it is a community health nurse who has to decide what to do in such case. Should she refer or should she conduct the case? How will she save the life? She has to promptly take the decision and then do the problem solving. Now, when we talk about functions, again we can say that these functions we have to see that what all duties or responsibilities she is going to do in a community. Now, first is identification of community, which we already discussed so much about community health identification. To know the community is important before we go and give the care. We cannot give care to an the community which we do not know. For example, when we go to a community and find out that the type of people over there, suppose there are more infants in a community, so we have to plan our care that we have to emphasize more care on infants. Maybe IMR or MMR is very high, so maybe our planning for care has to be based on MCH care. So this is what will help us to plan our care. Now when we come to the planning of healthcare, then it is we have to plan certain activities for the community. Like for example, for infants or for mother and child, we have certain objectives, we have certain plannings to be done, that what all we are going to do for an infant. Maybe giving health education on immunization or on nutrition or on hygiene based on their needs. So these services have to be planned. This now where we have to plan, is it in the community or in the school or in the clinic or in any other working areas. Then what all we have to do, maybe we have to give health education on what, it is maybe on environmental sanitation, maybe on nutrition, maybe or any other health aspect which we can do according to the needs. Now are we going to give direct care or we are going to provide somebody that who can give the care. So this direct care is usually a patient with diabetes who needs daily insulin. So maybe we have to give at home. So this giving insulin, whether she is going to give or she is going to teach somebody in the family who can give the care. So this all has to be done in planning. Then implementation. In implementation, she has to actually do what she has planned, what action she is going to take. She is going to the family, she is going to the clinic, planning the clinic, organizing, implementing means conducting the actual clinic, maybe immunization clinic, MCH clinic, whatever clinic she has to conduct, she has to implement. Then evaluation, we talked so much about evaluation. So this is taking the feedback of what all work has been done. Usually this evaluation in community health is very important because sometimes we need to communicate written that what has been done and what is left to be done for other people who are going to do this. Now this is usually done, if you have seen in community health records, infant, toddler, antenatal, family planning, family welfare, family folders. All these are the records which are maintained in a particular MCH center or otherwise for each individual of a family or for the community. Now these are compiled as daily, weekly, monthly, annually, and these reports are compiled annually for all the centers to give the statistics which we have in our records, that the infants, these many infants died, these many infants sick because of this, these many infants or children or mothers are healthy. All these aspects we get from the reports, and these reports will give us the feedback, the work done and the work to be done. And this we can say that this evaluation can be formative as well as summative. As I discussed earlier, formative is which we do during the program and summative is at the end which we make the report, and this report will give us the feedback for evaluation. Then participation in survey. Survey is one of the important aspect of identifying the health problems or the health status of a community. Now survey can be of different types. Suppose you want to know about family planning or eligible couple. We need to do the survey that how many eligible couples are there in a particular community, and we have to protect those couples, maybe by temporary or permanent method. We have to give education, as Mrs. Sarkar was saying, that the population is increasing day by day, and we have to limit the population by giving the doing survey. We need to know eligible couples, and then conducting research programs. Research evidences will help us to improve our health, the care. So we need to have certain research evidences to give the care.
Well, in this program we have had on introduction to community health nursing, the discussion was on what is community health, and how do you define community health nursing. Community diagnosis was elaborately discussed. Also there was discussion on what information can be obtained and what are the methods by which we can obtain the information from the community. The discussion on what preparation a nurse should have for working in the community was also elaborated. There was also elaborate discussion discussion on community health nursing process, and the functions of community health nurse. I am sure this particular program will give you insight that it is not very easy to become a community health nurse. You need to work very hard to develop that kind of rapport and relationship with the community so that you are able to provide the effective nursing at the preventive level, promotive level, as well as follow-up level or rehabilitative level to the community. Once you are able to do that for the community, I am sure you will be able to achieve many more goals from this in the same community when you are working. Thank you very much, Mrs. Sarkar, and thank you, Mrs. Patni, for being with us in the studio. Thank you very much.